Welcome to the Human Momentum Podcast. I'm your host, Erik Schabert. I created this podcast to leverage 12 years of osteopathic medical training and over a decade of experience in primary care medicine to help sort through the confusing and often contradictory health information found on the internet. I want to distill all this information down into a form that you can use every day to optimize your health as you move forward through life. So if you are looking to get to life's finish line with the ability to do all the things that you love intact, then this podcast is for you. If this is your first time here, please don't forget to smash the subscribe button and throw us a like as well. I'd also love it if you would share this episode with people in your life who you believe can benefit from it. It really helps us get this information out to more people. With all that said, let's move on with today's episode. Welcome to today's episode of the Human Momentum Podcast. Today I'm going to try to get into detail and talk about what we know about how vitamin D works in the body and what approach to supplementation and testing may be right for you. This is a complex and rather controversial topic in medicine, and one that there's a lot of contradictory information on. So I'm going to try and wade through the medical evidence that we have right now and what it means. Before I go into the existing research on vitamin D, I'd like to talk a little bit about what is known concerning how vitamin D works, what it does, how that relates to why so much research has been done on the topic, and these sorts of things. Vitamin D was first discovered in the 1920s as scientists sought to understand the disease rickets. What rickets is it's a bone disorder that results in inadequate mineralization of bone with calcium and phosphorus, and thus the bone becomes very soft and not very effective. What we found as researchers went into this, that there was this substance, vitamin D, and its deficiency seemed to be the most common cause of rickets. And as such, our initial understanding of what vitamin D was and what it did was that it was this thing that we needed to either consume or get in sufficient levels in order to avoid having inadequate mineralization of bone. And it was something that was involved with the absorption and utilization of calcium and phosphorus. That's why it was named as a vitamin, and as it was the fourth major vitamin that was discovered, they called it D. In the 2000s, evidence began to emerge that vitamin D was doing a lot more than just modulating calcium and phosphorus in the body. There began to be a lot of observational studies that correlated lower than ideal vitamin D levels with things like diabetes and obesity and heart attacks and cancer. As a result, we started to see a lot of additional research funding, both in the form of observational studies and new randomized control trials, trying to assess exactly what vitamin D was doing. Some of the early in vitro kind of looking at what vitamin D was doing in human cells, as well as what it did in animal studies, revealed that not only did we have vitamin D receptors associated with calcium and phosphorus absorption and utilization in bone, but we had vitamin D receptors in the nucleus of most of our cells. And it was doing a lot more than we thought. It turns out that it was involved in signaling for both what we call innate and adaptive immune function. Examples of that are that it was helping our T cells, one of our immune cells, target infections and abnormal cells appropriately. And it was also involved with things like producing antimicrobial peptides. These are proteins that kill things like bacteria and viruses in the skin. So again, we have this emerging research that's involved in more and more. We also found that it was involved in optimal function of the heart and involved in regulating blood pressure. We found it was involved in the production of insulin and also in signaling that resulted in improved insulin resistance. Obviously, based on all this information, deficiency of vitamin D was thought to be potentially terrible, especially when they started to also find that it was involved in signaling that triggered DNA repair during cell division And it was also involved with triggering defective cells, that is, cells with defective DNA after cell division, to undergo apoptosis, that is, programmed cell death. Based on these results, it's easy to see why there was thought that supplementing with vitamin D could reduce rates of multiple chronic diseases, many of which are major causes of death in the United States. As a result, we had a slew of studies assessing these patient-oriented outcomes. Did we see, for example, did we see reduced rates of cancer, reduced rates of heart attacks, strokes, reduced rates of diabetes, reduced rates of other primary diseases? For the most part, when we started doing randomized controlled trials to assess this, we didn't see the kind of benefit that our early research was suggesting. Some studies did show a little bit of benefit, but it was always a little bit more mild than we were hoping. The most profound positive study was an observational study that was conducted over the early phases of the COVID-19 pandemic. In that study, it was found that people with a history of vitamin D deficiency who were given vitamin D supplementation prior to the start of the pandemic had much lower rates of COVID-19 infection as proven by lab tests, and they had significantly lower COVID-19 hospitalizations and deaths, particularly in those individuals with additional COVID-19 risk factors. This is some fairly solid evidence and also corroborates prior research done on influenza with regards to vitamin D supplementation. One of the few studies that really showed definitive benefit for vitamin D was one supplementing individuals with deficiency and seeing what the rates of influenza infection and influenza hospitalizations were. Very interesting stuff, but not quite the profound results that everyone was hoping for. More recently, there were two studies that did show some interesting results. First was one called the VITAL study. This was completed in 2018 and was a study with more than 20,000 adults across the United States looking at men over age 50 and women over age 55 with regards to cardiovascular risk and cancer and other diseases associated with aging. And what they did was they took this group and, in a randomized controlled fashion, randomized folks to either receive 2,000 international units of vitamin D and a gram of omega-3 fatty acids daily or a placebo. And in this study, they did see a reduction in both heart attacks and strokes, but it was not statistically significant. And they did see a reduced incidence of cancer, but again, not statistically significant. Interestingly, a post hoc or after completion of the study analysis of the data did show that individuals who were receiving the vitamin D and omega-3 supplementation daily over the course of 5 years had statistically significant less shortening of their cellular telomeres than individuals who did. What telomeres are, for those of you who haven't heard of it, they're little tails on the end of DNA. And it has long been theorized by scientists that as these telomeres shorten over the course of our life, that is actually a measure of cellular aging because these telomeres do tend to get clipped. Every time a cell divides, all of our cells replicate themselves over the course of our lifespan. And as such, we think that these telomeres shortening are a measure of cellular aging. If that is correct, then this intervention did show benefit in slowing cellular aging, but this is far from a settled question. Okay, other than that, VITAL failed to show a statistically significant reduction in risk factors. I'm going to go in a little bit later about why I think that this study and so many others like it failed. But Before I do that, I want to talk about another study, a more recent one called Target D. Target D is interesting because in this case, we saw individuals over the age 50, all of which had a prior diagnosis of coronary artery disease. And these individuals were all found to have vitamin D levels below 30 nanograms per deciliter. For the most part, we define vitamin D insufficiency as a level between 20 and 29 nanograms per deciliter. And we define a vitamin D level under 20 as vitamin D deficiency. Now, this is measuring vitamin D2, which is the primary form that vitamin D is stored in the human body. So, what they did in Target D is they took individuals with those lower levels and they randomized them to either receive a placebo or to receive targeted vitamin D therapy that brought their level into the range of 40 to 80 nanograms per deciliter. Vitamin D dosing in this study was tailored to hit those target ranges and would be reduced if they started to hit the upper limits and increased if they were too low. These individuals were followed over the course of several years to see what happened with heart attack risk. Well, we saw once again a statistically insignificant reduction in major adverse cardiovascular events, that is, heart attacks and strokes, initial events in these individuals. But interestingly, as we continued to follow them, the individuals in the treatment arm had a much lower and very statistically significant risk of a second adverse event. This is interesting. It's the first time that we really had vitamin D supplementation pan out the way that investigators had hoped when we first discovered these mechanisms of how it worked. I think we very much can theorize that the reason for the difference between this and all these prior studies, including Vital, is that they used a targeted therapeutic range. I think it's also quite possible if this study had been larger on par with the size of the Vital study, that we might have seen a statistically significant reduction in first time events as well. So the next question to answer is, what does this mean for all of you out there? I think as far as recommendations, because of my personal experience with vitamin D, and let me go into that a little bit. Back when I was in medical school, during my first 2 years of medical school, this won't be a shock to you, I was inside most of the time. I was dealing with chronic musculoskeletal pain due to prior injuries, part of what got me to pursue osteopathic medicine instead of allopathic medicine. And the DO who was taking care of me, one of my mentors, couldn't understand why I couldn't get a sustained positive response to the interventions that he was doing. One of the things he thought to test was my vitamin D level, which turned out to be very low at 14 nanograms per deciliter. Well, when I supplemented and got my level up above 40, that was part of the pathway to me getting an extended remission of the lower back pain that I had been dealing with. I also noticed that my mental acuity improved and my energy levels improved very significantly. Now, I don't know whether to attribute that to the improvement in vitamin D levels or just the fact I was able to sleep better with lower pain. I think it was probably a bit of both. As I went on into clinical practice, I took that experience with me. And when I saw patients who were coming to me with chronic pain issues, something that happened frequently because I was an osteopathic manipulative medicine specialist, very frequently I would find these individuals had lower than ideal levels of vitamin D. And when I replaced them into that 40 to 80 nanogram per deciliter range, these individuals saw an improvement in the same sorts of symptoms I saw an improvement in: better mental acuity, better energy levels, less pain. Additionally, some of these little phantom nerve shocks, symptoms like a twitchy left eyelid, and weird symptoms like just phantom pains would suddenly go away. As a result, I think I'm pretty safe in making a recommendation that if you are dealing with chronic pain And if you're having some weird unexplained symptoms that could be nerve or muscle related, and your physician has been unable to diagnose a good cause, that getting a vitamin D level checked, checking that 25 hydroxy vitamin D2 level is productive in that if it's low and you replace it very frequently, you will see an improvement in symptoms. I would not recommend getting a vitamin D level check just as a routine thing. Although now I would also say if you have a strong family history of heart disease or have known cardiovascular disease, that getting a D level checked and getting it replaced would be worthwhile based on the results of the Target D study. I think it's too early to say definitively that this is how things are going to work. I would really love to see more research using targeted vitamin D levels to get a better idea. I also want to put out there that there are some observational studies that indicated vitamin D levels above 60 may also increase cardiovascular risk and may also increase cancer risk slightly. As vitamin D looks like a hormone with the location and type of receptors, the way it's distributed in the human body, and the way it works, I think it is safe to say that there will be a target range in which things are ideal. Going too high or too low is problematic. And for those of you that have tuned into my channel in the past, I did cover an incidence of vitamin D toxicity, an overdose of vitamin D with my parents due to a compounded supplement that had much more in it than it was supposed to have, and a similar outbreak of vitamin D toxicity in some islands off the coast of Spain, also due to a bad supplement. As a result, if you are supplementing with vitamin D, I definitely recommend getting levels checked to make sure you're not pushing too high. Any level above 80 and you want to restrict the intake, that above 100 is where we really see definitive toxicity. And in those two cases that I just referenced, we had levels that were far higher than that. My father's level, when it was first checked, was above 400. So definitely look into getting vitamin D levels checked if you're experiencing chronic musculoskeletal pain or chronic fatigue, or if you are at risk for cardiovascular disease. I think those are the things we can say definitively. And otherwise, we just need to monitor the research going forward to see if there's going to be an indication for more of this. Also, it should be noted for every human being, there is a potential to make enough vitamin D. Vitamin D is made in melanin cells in response to exposure to ultraviolet B radiation, UVB, from sun. The recommendations of what is going to get you sufficient levels just due to sunlight are 3 to 5 days of exposing your arms, your legs, and your face for anywhere from 5 to 30 minutes, depending on the time of year and what latitude you're at, for people with fairer skin, and 40 to 60 minutes if you have dark skin. When we're talking about people with dark skin, it means you're an individual who doesn't regularly burn, that you can get fairly extensive sun exposure without getting a traditional sunburn. That doesn't mean you should just go nuts and be in the sun all day. It does mean 40 to 60 minutes should be safe and absolutely fine. I also should note for individuals who live in lower latitudes, closer to the equator, or even honestly the southern half of the United States, if you're fair skinned, you can get that 5 to 30 minutes, probably needs to be more like 10 to 15 minimum, either from 8 to 10 a.m. or from 4 to 6 p.m., and you'll still get adequate D production. All right. I hope that this was informative for everybody. If I generated additional questions, feel free. All right. I hope this was informative for everyone. If you have additional questions, feel free to fire away in the comments, and I will try and respond as I can. Vitamin D is a very potent substance. I do believe it's a hormone and something that I think can be of great benefit long term if we get it to sufficient levels in individuals who are suffering from symptoms from deficiency. Again, I hope you all found this informative. Please do like, subscribe, and share, and I'm going to see you next time.